this is the orbicularis oculi, this is the orbicularis oris, and this is the mentalis muscle which I'm lifting down. And you'll come across in this particular region, will be the Adam's apple, and you little bit search here, you'll come across the thyroid gland is enclosed here. You have your other particular muscles, this is the masseter here, and the sternocleidomastoid, which is just here, not proper. This in general spotters, we do have all this stuff. You can observe here that this is the sternocleidomastoid muscle, one of the most important muscles out here. And commonest spotter we get here will be the frontal layered sinus. Then you have the sphenoidal layered sinus, sphenoethmoidal recess. This is the cerebrum, and this will be the corpus callosum. The cerebellum with the arbor vitae. You've got your pons medulla oblongata, the entire spinal cord here, the intervertebral joints here. And do you have the hard palate, the genioglossus here? The genioglossus is comparatively very important muscle. Commonest spotter, the soft palate, the opening of the auditory tube. The epiglottis is present here. Epiglottis, this particular portion. This is the commonest things what we see here. This might be the foramen magnum. Is the foramen magnum, where the spinal cord is just entering inside. And invariably, we have the same spotter in this particular region. And also, this the same spotter here. I can show you many things, which I just want to show you. The cerebrum, cerebellum. This is cerebellum, same structures, genioglossus. Here we have the thyroid gland. This is the thyroid gland, the Adam's apple, which I just showed you that side. The anterior belly of digastric. So obviously, this is the face part. The eye here, you can observe the eye. And this person is an edentulous, so he had no teeth. You can observe this particular thing. The tongue, very important structure. Tongue shows many features. You can observe here. This is the tip of the tongue. This is the dorsum. They have got the further papillary part. This might be the glottis. I'll do it like this. Yeah, here we can easily approach the papillary part with lots of papillae. Circumvallate papillae are 12 in number, with microscopic in nature. This palate is completely edentulous person, and this is the brain. As usual, the spotters remain the same. There's nothing else much different in the spotters. And here, parotid gland, parotid duct. This is the duct, the gland is excised here. This is the parotid gland. Parotid duct, the submandibular gland. The mandible internal part here. This is the mandible internal part with the artery, the inferior artery, which I just talked about. It's present here. Completely, it's going inside and comes out as mental artery, which is near the junction of the premolars. Main thing in the spotters will be doing this particular thing, that is a sinus, a nasal cavity with the concus here, the sphenoidal erythmoidal recess, the cerebrum, the soft palate, hard palate, genioglossus, mylohyoid. This will be the mylohyoid muscle, the floor of the oral cavity. The first vertebral joint will be the atlanto-occipital, atlanto-axial intervertebral joints here. And this is just out there. It's just present here, everything. This is the epiglottis. Identify the gland, give its blood supply. This is spotter number 1. So identification, it should be the submandibular gland, which has been excised. So the first spotter answer is submandibular gland. If it was kept here, it would have been thyroid gland. Here, sternocleidomastoid. Here, parotid gland. 2 will be identify the pinned area and M2 sinus is opening. This is the nasal cavity. You've got your hiatus semilunaris with many of the frontal, middle, ethmoidal layered sinuses opening there. The maxillary sinus opens in this particular region. It's not clearly seen, but this is what it is, the spotter here. When spotter number 3, identify the pin structure, give its nerve supply. genioglossus, the easiest spotter you can get. This is the genioglossus with its nerve supply, which the students have to write here. Spotter number 4. Identify the pin structure, give its action. This will be the soft palate. Soft palate, this is what the spotter is, the soft palate. And actually the students have to describe how it moves and helps in the deglutition method and other things. Spotter number 5, identify the pin structure of tongue, give its function. This is the tip of the tongue. The answer should be particularly tip of the tongue because tongue has got a tip, body and oral and pharyngeal parts, and the root of the tongue is completely attached towards the hyoid bone. So this is the tip of the tongue. It's free, lies between the incisors. Spotter number 6 will be identify the pin sinus. Where is it open? This is the answer. If it was here, it would have been frontal ear sinus opening in this particular region, the agonasal region, the nasal cavity, and so the spotter here will be the sphenoidal ear sinus. Spotter number 7, identify the gland, give its blood supply. Parotid gland. Parotid gland with its duct, very easy answer. The submandibular gland, the only major gland which is identified is this. Very easily identifiable parotid. The word para means around otic means ear. Spotter number 8, identify the foramen structures passing through it. The easiest, in the mandible you have 2 foramens, the mental foramen as well as the mandibular foramen. So this spotter is the mental foramen, very easy, and the structures passing out through it is the mental artery with its nerve and a vein. Spotter number 9, identify the structures passing through the foot. So this is a hard spotter. So here we have incisive foramen, very easiest one to be identified with the incisive nerve coming out, its cover. Greater palatine, lesser palatine, ovary, your foramen lacerum, magnum, jugular are all the favorites here. It's one of my favorite spotters which I generally keep always whenever I go. Identify the colored suture. Colored suture, okay, often chalk piece has been used here. This is it. This is the colored suture, metopic suture. The answer should be metopic suture. Its importance, it is present in the fetal skull, disappears or ossifies as the age goes on. Thank you.